welcome to the Still Life Innovators series. I'm Liz Lundery, and today I have the honor of interviewing Dr. Parul Dua Makkar. Dr. Makkar completed her DDS degree at the University of Oklahoma College of Dentistry in 2003. After practicing in Alberta, Canada, she completed her general practice residency at Staten Island University Hospital in 2007 and has been in private practice ever since. Currently, she's the owner of PDM Family Dental in Long Island, New York. She's co-authored several dental journals, presents lectures to dentists, and has been a guest at several podcasts, including her own podcast, Life Interrupted. She's been featured in the American, Canadian, and British dental journals. And in 2022, she was the recipient of the Denobi Award, as well as the Long Island Excellence in Healthcare Award and Power Woman of Long Island. Dr. Makkar has been awarded the Outstanding Women's Achievement Award by the Indian American Forum and named Healthcare Hero, both in 2023. Welcome, Dr. Makkar.
Well, thank you. Thank you for having me here, Liz.
Thank you for taking the time. So, Dr. Makkar, with your appreciation of the connection between oral care and overall well-being, how do you discuss this with your patients?
Oh, it's so important. I think oral health is the gateway to overall health. And my patients, just yesterday, I had somebody who came in. He's like, I got diagnosed with prostate cancer. I'm like, well, are you getting radiation? Make sure you have fluoride trays, keep up with your appointments, patients going in for surgeries, people who come in and they're like, yes, I know I have diabetes. I haven't been to the dentist in a while. Or I've had a heart attack. That shouldn't stop you from coming to the dentist. Even more important for you to come to dentist because It's all linked together. So honing in on these points. And then I talk about even stuff like, they're like, oh, I see a wear on my teeth. Are you snoring? Have you ever been told, yeah, I got braces, but then it relapsed and I know I have a narrow arch, and then I dwell into all of these other talking about sleep apnea. So it's a comprehensive approach. And that's how, when patients come, it's like, what brought you here? What is wrong with you that you think you need to see a dentist? Is it that you're in pain or you've been told because they said that I went to my physician, I need something done, but I need to get cleared medically and dentally. So, and that's how I approach all my patients is let's talk about you, what brings you here and not just open your mouth, let's count your teeth and be done,
Yeah, I have the same philosophy and the same approach. I also, help others learn about this and implement that. So just looking at the patient holistically is incredibly important, and we're not separating them, their mouths from the rest of their bodies, and they're just not aware of those connections, which is our job to educate them. So, and with all that you're contributing to your community and to the world at large, you lost your brother, also a dentist, to oral cancer. And I know how devastating this is. I lost my sister to metastatic breast cancer as well. And it really just is so difficult for the entire family, of course. So you co-authored his award-winning book, Life Interrupted, Dr. Dua's Survival Guide. Please share this experience with us.
Yes, I'm sorry you had to go through that. It is a very traumatic experience. And cancer, our siblings are done with dealing with cancer, but we're not. It still takes a seat in our table. So the experience with Manu wrote the series of blogs. That's what this book is composed of, as he was going through cancer treatment, and he documents his journey and reflections of life as he's facing death. So he talks about different topics about morality, not losing hope, ability to endure, how we make mistakes, failures. And so it's his thoughts, and he wanted to be published. Unfortunately, time was not on his hands. So, and I could not do much for him as a dentist, as a sister, because he was in Canada and I'm in the US, and a lot of his treatment was during the COVID lockdown between the countries and no vaccines. So after he passed, that's all I had was his writings. And, he had wanted to be published and I couldn't do anything else for him. So finishing his story, sharing it with the world, sharing my brother with the world, was a way of healing, was a way of processing. and also a way to highlight how, even though we're both dentists and we still missed it, it still didn't get the earlier diagnosis, even though he was treating by an oral surgeon. The diagnosis was delayed. How we need to pay more attention to our bodies. We need to keep up with our checkups, go in, get the recalls done, if you see something that doesn't heal, get it checked out. So sharing his message and highlighting the importance of how oral cancer can be so aggressive, and we need to be more diligent about screenings.
Absolutely. As a trainer, I train dental offices, and I really encourage them to do an oral cancer screening, including a head and neck exam, looking at all the lymph nodes and everything else, but doing it every time they come in for their hygiene appointments or when they see the doctor. So it's not just done once a year. I've had a patient myself who had an enlarged lymph node who was coming in every 12 weeks, didn't have it the previous appointment, but had it on that appointment.
Right.
So it can happen at any point. So we need to, be very regular and frequent with these exams. Why not? They don't take very long. And if we're checking the lymph nodes, it feels good. The patients think it's a massage. They love it,
Yeah.
so it's a great way also to, have that conversation with them. And I know at Stella Life, we do donate our products to those who can't afford it, who are going through chemotherapy and radiation of the head or neck, as it's so debilitating and cause so much mucositis. So, we're really right there to help these people as well. So, you do lecture to dentists so you can educate them about risk factors, prevention, and early diagnosis. So, what message do you have for all of us about this?
That cancer can happen to anybody at any time. It is one of the most increasing causes of cancer right now. Oral cancer is the top six, and we're diagnosing almost 60,000 cases annually. It doesn't, like you mentioned, doesn't take long to screen a patient. Screen them, ask them, hey, have you felt something that feels odd to you? Or especially if it's unilateral, have them stick out their tongue. It's in conversation, doesn't have to be taking, a half an hour. It's a couple of minutes, spend that extra minute or two. You will save a life. And when I lecture, I talk also about the impact of cancer, not only what it is clinically and surgery and all of that stuff is needed, but how to take care of your patients. And in my lectures, that's one of the things I talk about is using Stella Life products while they have mucositis, if they have dry mouth, if they have other issues, and what other ways to help alleviate some of the pain and discomfort orally and take care of oral health going through this. So talk to your patients, don't be shy about it. This is our field, and we need to be more vigilant about screening our patients every time they're in the chair.
Absolutely. Yeah, let's all keep doing that and looking out for these signs. I know I had a patient who was actually the son of the doctor in whose practice I was working, who ended up having cancer of the larynx. And the first symptom that he had was difficulty swallowing.
Mhm.
And nobody had talked to him or asked him about that, but that was an early symptom. So just broadening as you are doing and teaching everything that we look at so we can, truly have an early intervention, which of course the recovery rate is much higher if we can do that. So
Awesome.
thank you so much for everything you're doing. And again, with your brother in his name, getting this message out and doing that wonderful book, which is I've been really enjoying reading. It's very moving. So thank you for that. And
Yeah.
thank you everybody for joining us today at the Stella Innovators series. Looking forward to seeing you next time.